welcome. I'm good, thanks. Please sit. I believe I've seen you previously, but I'd like you to explain again. What is your complaint? What is it that troubles you?
Since I was 14, I've been dealing with gynecomastia in both of my breasts, which has caused me considerable discomfort. Therefore,
You shouldn't say there's gynecomastia. You can say there's an enlargement in the chest. Gynecomastia is a medical diagnosis. Let me confirm that after I examine you. Okay, you look good in sports.
Then...
Thank God. Your biceps are nice. You've exercised a lot. We didn't pass, even with sports. Didn't we pass?
It didn't pass, even with the sport. As we weakened, the end became clearer. As I continued to develop my chest muscles, it became even more noticeable.
Your breast gland is a little bigger. It seems that your breast tissue is larger than your fat tissue, making it look more developed when you build muscle, indicating gynecomastia. So you might have a breast tissue dominance, for example. While you're explaining, I'm thinking in my head, this could be this could be that. Come on, let's examine you. We will do the exam while standing. I kindly ask you to take off your t-shirt. I'll sit down, as I'm a bit old. You can leave your t-shirt like this. Now, while we check gynecomastia, Yusuf is flexing his chest. This will be the case in both our pre-surgery checkups and post-surgery assessments. Let's take a look at the chest muscles. When you flex your chest muscles, the tissue that plays between the muscle and the skin when it is so firm shows your gynecomastia. Look, in this section we can describe it as fusiform or almond-shaped. The larger one is like this. There is a milk gland here. This milk gland is causing your discomfort. Now, it may shrink because I touched it or because the colored part contracts in the cold. However, when you put on a slim fit t-shirt in hot weather, it tends to leap forward more. That's what disturbs you. You must have seen the technique I apply in our videos. We make an incision here and here. There will be no incision at the nipple. Gynecomastia is in this area. However, we always operate on a wider area. Why? To avoid any indentations, we work on a larger area. We want to ensure that it doesn't have a coasters-like dip. In this area, we should extract most of the fat tissue between the muscle and skin, along with the whole milk gland. When you touch yourself by tensing, please do so with the muscle. Look, you should get rid of this soft tissue. It should be this firm when you hit it. There should be a knocking sound. We need to get rid of this for you. The surgery takes 40-45 minutes. After it's done, we will close the incisions we made here with self-dissolving aesthetic hidden stitches. There will be no need for stitch removal. Then we'll put a corset on you, wake you up and take you to your room. You can wear the t-shirts. You will stay with us in the hospital for about 3 to 4 hours. Then we will discharge you. We will have our first checkup 2 days later. After the first checkup, if everything is fine, we will allow you to take a bath. We will see you again in 2 weeks. If everything is fine, we will complete the corset usage. We might suggest continuing to use the corset for another week, but it's unlikely. The surgery is not a painful one. You may have some minor aches, but we won't have any serious pain issues. In the first few days, the corset will be quite tight. We will put a towel-like cover inside. You will feel relief when we take it out after 2 days. The corset is tight at first, but you'll relax after a couple of days. You'll start taking baths in 2 days. After bathing, you'll continue wearing the corset, but you'll take it off only while bathing. The surgery is not a painful one. You might have minor aches. There will be restrictions in your arm movements. What do I mean? When you want to lift your arm upwards, this chest muscle pulls you downwards. We will start stretching exercises in about 2-3 days. By doing these physical exercises, you'll regain full arm mobility within a week to 10 days. You're clearly an athlete. In 2 weeks, you'll start weight training. You'll begin with lighter weights, not the ones you use today. Start with lighter weights. You will gradually increase the intensity of your exercise. After a month, we will allow you to swim in the pool and the sea. After 1.5 to 2 months post-surgery, you'll be able to train hard enough to prepare for the Olympics. You'll start lightly in 2 weeks. You'll progress gradually. In 2 months, prepare for the Olympics. Don't overexert yourself. The risk of complications from the surgery is minimal. Yet, as with all surgeries, this one too presents certain risks. What risk could we potentially encounter? The evidence of the cut we made. At first it seems redder than normal. After 2 to 3 months it starts to calm down. In 9 months to 1 year it will reach 90% of your skin tone and take on a subtle appearance. There is a 2% chance that the permit could be denied. It's important not to neglect the inspections. If we find a bad trend, the medical names for these are keloid or hypertrophic scar. If we find the right path for this table, we can offer more solution alternatives and treatments. Initially, we could see hematoma and later on seroma. In Turkish, hematoma means bleeding or blood pooling in the surgery area. Seroma indicates serum fluid accumulation. Hematoma happens in the first 1 to 2 days, while seroma can develop after 1 week to 10 days or even 2 weeks later. We seldom see either condition. The end result won't be negatively impacted, but you should come for checks 4 or 5 more times to drain the accumulated blood or fluid inside with a syringe to be able to empty it. Numbness and loss of sensation will occur in the skin at the surgery site, but this will gradually improve. It will resolve over weeks or months. One must be patient. Because we will gradually see improvement, we won't see sagging or folding of the skin in 99% of cases. The examination findings are quite good. However, there are still measures we can take against these. After the surgery, we must consciously maintain this tough stance. This posture can cause skin strain, so we must be careful. We should take charge of our recovery. First, we need to focus on this. Secondly, we should do stretching exercises. The third measure is to start exercising 2 weeks later. The fourth measure is patience. Because visually, healing may seem complete in 2 to 3 months, but at the cellular level it continues for a year. Therefore, we must always be patient. We will call you for checkups in between. Use this cream or take this medication. You may have suggestions. We need to determine these based on progress. This is the rough summary of what I will explain. It's related to gynecomastia. Is there any question you would like to ask, Professor? Professor, can I continue training until the day of the surgery? Can I work on my chest muscles? Technically, yes, you can. This is not a problem. It won't interfere with the surgery. Let's say you're having surgery tomorrow. You can do this sport, but don't overdo it. Don't push yourself too hard. The chest muscle. I have no other questions. Everything is very nice. You explained it well. If you happen to have any questions, please feel free to reach out. You can contact me or my teammates. If I'm not too busy, I will answer my phone calls. If you have any questions, whether you undergo surgery or not, always reach out to us, okay? Then I wish you good luck. My friends will handle the timing. Hopefully, if fate allows, we will see each other for the surgery. God willing. Get well soon. Greetings. Hello, doctor. Welcome. Welcome. Hi. Why are you consuming food and drinks in front of the child? It's good that it's cheap while doing this for us, right? Now something else. It will pump for you. Yes. Honestly, in order. Come on. Come on over. Let's sketch you. Let's take some pictures. If you have any questions, let's address them.
What do you expect from the operation? My expectation from the surgery is to have a flat chest. I will keep improving from then on. I will be more eager about it. At 18, it was actually there when I was 14. When we go to a different hospital, they said it would be valid until we are 18. If it isn't, they advise surgery. I didn't pursue sports. But you are working on your chest too. I am working on it. The more I work, the more defined it gets, because it has separated from the fat. Are you excited now? Yes, I am. Very excited.
You did your exercises. You can leave it like this. Turn towards me now. Come on if you can get out. Today, if there's no seroma, you will be free from the corset. No work, teacher. You will start weight training in addition to the arm movements. Finally.
The teacher has been asking all morning if Ellie will start me on weights today.
You will start today. Even if you have a seroma, you will begin. Whether you get rid of the corset or not, the weight is starting now. Let's take your bands. You can pull your arms back. No, teacher. That was it. Therefore, we will continue to use the corset for a few more days. I couldn't free you from the corset today, and I will call you for a few more checkups. Please press down here like this, but from now on you can let me handle it. You are starting weight training now.